Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals focused on the health, wellness, and well-being of residents in Western North Carolina. Our special guest today is Dr. Ray Dunkelberg. Dr. Dunkelberg has practiced adult medicine as an internal medicine specialist for 45 years, the last 35 years here in Brevard before retiring in 2010. In recent years, he has done volunteer medicine at the Free Clinic in Asheville and other venues like the Western North Carolina State Fair and a mission trip to India. He is married to his lovely wife, Jane, and they have 4 children and 4 grandchildren. Welcome to the program today, Dr. Dunkelberg.
Thank you, Angela. It's a pleasure to be here.
Well, we are all working on what do we do with this thing called COVID-19, and there's a lot of information out there. So ground us today with some facts about this virus.
All right. COVID-19, as everyone is well aware, is a brand new virus on the planet. No one has ever seen this virus before. And it's only been recognized since about the middle of December. So in 90 days, it has spread from where it originated in China to cover the entire globe. It is obviously incredibly contagious. It is spread by droplets of moisture, and it's easily spread very often by people who don't know that they have it and have almost no symptoms or minimal symptoms. We found that it can be spread as far as 6 feet away by a cough or a sneeze, and then it can survive on surfaces up to 10 days. One of the major reasons that it has spread is because when people are early on in the course of the illness, they either have no symptoms or minimal symptoms, and therefore they go about their usual activities, and in doing so, spread the disease to other people. And being extremely contagious, it has spread like wildfire throughout the entire world. It's estimated that 80% of us will get this virus. We just don't have any immunity. We've not seen this virus before. The good news is that of the 80% that get it, the majority of those people, again, approximately 80%, will have minimal or no symptoms. But of the other 20% of people who do get it, many of those will require hospitalization, and a smaller percentage of those people will require ventilatory support. They get very sick, sometimes very fast, and the recovery takes a week or 2 weeks to get over. And during that period of time, they require a complicated team of physicians and nurses and respiratory therapists to take care of them. Requires a huge amount of manpower. Taking care of these patients is very difficult. It's very strenuous. Each of the caregivers are themselves at risk of getting this, and then they have to worry about taking it home to their families. It's very stressful. We have obviously only a limited number of physicians, nurses, respiratory therapists, and the whole impetus of slowing this down with the social distancing, washing your hands, using sanitizers on surfaces is designed to slow this down. And if we can't slow it down, we'll have the same sort of thing going on in Western North Carolina that we've seen happen in New York and Italy and other countries. So the idea is to try to slow this down as much as we can by realizing how it spread, how contagious it is. It's probably been in Western North Carolina a couple of weeks. We haven't been able to test for it. We're starting to see some cases, but we know from looking at other countries that once it begins, it rapidly spreads and soon overwhelms the medical care system. So it's important that each one of us follow the guidelines of social distancing, 6 feet, 10 feet, hygiene, cover your nose or mouth if you cough or sneeze with your elbow or your shoulder. If you do cough or sneeze into a tissue, throw that away. Wash your hands frequently. These droplets that have the coronavirus in it can be easily picked up with your hand from a surface in your kitchen, your doorknob, your steering wheel, and so those surfaces need to be cleaned. And you should always assume that you've got it on your hands. Wash your hands before you eat, before you drink or eat anything. The virus enters your body through mucous membranes, through your eyes, your nose, and your mouth. So try to keep your hands away from your face. Do wash your hands frequently. And as most people know now, to properly wash your hands, it requires soap and water for 20 minutes. You can use a hand sanitizer if you don't have a sink and a place you can wash, but it doesn't work as well. It's not as thorough as washing with soap and water. So the main people in Western North Carolina and Transylvania should assume when they're out in public that the person that they're approaching has it, and you should also assume that you have it. You should distance yourself from other people. You don't want to unwittingly give it to someone else, and you don't want to get it yourself. And so that's the reason for the social distancing, for all these other things, the hygiene that we've talked about. If we can buy some time, we can take care of the number of cases that we see in the hospital. If the hospitals get overwhelmed, the mortality goes up astronomically because there just aren't enough people to take care of the sick folks. If we can slow this down, we can take care of the sick people that need it. We can help protect the hospitals so that they're there. If you have a heart attack or an automobile accident, they'll not be overwhelmed. Taking care of these other folks that are so critically ill. And we can get through this. We can buy some time just to settle some other strategies going forward. At some point, we'll have vaccination for this. And of course, the whole world is facing this dilemma everywhere. And the best minds in the world, the scientists, the epidemiologists, everyone is working very hard to figure this out so that we can move forward, not only as Americans, but as citizens of this world. The whole world is reeling under this right now. And the social distancing and these hygiene mechanisms are the best tool that we have to get through this together.
Dr. Dunkelberg, I thank you so much. I believe that being informed with the facts is a very important strategy as we work together around the world to battle this pandemic as it comes. And so thank you for what you're doing on the front lines and for taking time to share with us today. We also want to thank our Wildflower Media for their creative and technical support in putting this program together. I want to thank Dr. Dunkelberg and the other physicians of the Roundtable, the board and the staff at Pisgah Health Foundation for their continued response to the challenges that we're facing. If you would like to reach out to the Pisgah Health Foundation, you may email them at info@pisgahhealthfoundation.org. Thank you all for tuning in today. Thank you again, Dr. Dunkelberg, for being on our program today.
Glad to be here. Thank you, Angela.
Wonderful. Stay tuned for more informational videos like this, and everyone, stay well.